Hello, and welcome to From Stigma to Strength, Keeping You and Your Mind Well. Today's show, we're going to focus on, this is again part of the series on mental health awareness, and this is our second show that we're doing, and we are joined by members of our police department. Why don't you introduce yourselves?
Hi, I'm Matthew Page Shelton. I am the Chief Executive Officer for Frontline Services, and we serve as the behavioral health partner alongside of Methuen Police Department.
Wonderful.
And I'm Officer Gina Scanlon. I work alongside Matt and will be part of the program that we're launching soon.
Lieutenant Jim Gunter, I'm going to be involved with the program as well from the administrative level at the police department. I am looking forward to working with the program.
Wonderful. So this task force that was created, the whole city, it's, as I said before, well, not today, but another day, it is part of a group of each department, police, fire, health department, the nurses, the senior center, school department. So we're going to do several shows focusing on different groups and how they help the public, how they help themselves to stay well. So we have a slide that we're going to put up. So police assisted therapeutic help path, which is the three of you are in this group. Anyone else from the police department involved in the mental health task force? Or is it you three?
Right now it's the three of us.
Okay.
There will be additional aspects of the PATH program come the fall, but for right now it's just this part of the program.
Okay, cool. So I'm going to ask you, so why did you start this initiative? So I know it's a group with the whole city, and so you each have your own focus on what you all do. So why did you start this initiative?
So the PATH program was something that came out of the mental health task force, this concept of having a police sort of based and a larger community based project that would provide direct mental health resources to the community during moments of crisis, but also during moments of prevention, right? So if someone believes that they're perhaps having a mental health issue or concerns around mental health, they would have the opportunity to reach out to this program. And so Chief McNamara reached out to myself probably about a year ago or so and asked if we could join forces to apply for some grants in order to start this project. And we worked with the police department to form a three-part sort of project. The first being focused on co-response with Gina, Officer Scanlon, taking sort of the lead from the law enforcement embedded side of the house. And we have our clinician, Crystal, who serves as the co-response clinician as along with that program. And then we also will be providing urgent outpatient support. So for members of the community who are waiting on a wait list to get into a mental health provider or are waiting or not sure how to get into a mental health provider, we'll be able to provide
Provider or
the short-term
facility?
service. Yeah.
Provider or facility? Either
Either
both?
one.
Either one?
Either one,
Okay.
yeah. And then in the fall, we'll be excited to add one last part to this project, which is going to be a community response team, which will be a mental health clinician and a peer support specialist. And that will work across the mental health task force department. So that will be police, fire, library, senior center, health department, anybody within the city who needs the assistance of that clinical team will be able to dispatch that team out to support.
Great. So this question's for you. What, and Lieutenant as well, what can the community expect from the police department
In regards to the
in
program?
regard to this
Okay.
program? Yeah.
So I think first and foremost, something to mention is there's definitely a need in our community for a program like
Oh, yeah,
this.
absolutely.
When we look at calls for service for the police department, 25% of our calls for service involve some sort of mental health struggle.
Right.
And so when we looked at those numbers and saw how high that percentage was, our community is struggling. So it's really important that we, work with the city in collaboration, integrate programs that, other departments in the city are putting forth and working together to help the members of our community. So when we talk about mental health and what our residents would expect from this program, I'll be part of a team that will be co-responding to calls for service. So a call comes into the police station, there's some mental health component to the call, and what that will do is trigger myself and the clinician to respond to that call. Once the scene is safe, then we'll be able to take over and follow that client through, providing them with connection to resources, or, getting them to the hospital if that needs to be the case, and those types of things. So from that co-response component, that's what, a member of the community would expect.
Yeah, so this is all done obviously privately, that no one will know, like say it's you that had this crisis, nobody but you will know that you are helping him unless you want to share that with your family, friends, or whoever. And how will you fit in as her?
She'll fall under me, and I'm going to be there just from the administrative side to make sure that anything that they need is being provided. I think it's important to know that, like Officer Scanlon said, 25% of our calls are for mental health related incidents, and unfortunately, the whole country is seeing this, and it seems like that sometimes we're dealing with the same people over and over again, and it seems like we're getting frustrated with that. And this program should be able to help people and citizens. And I think, correct me if I'm wrong, the goal here is at some point down the road is when it comes to non-violent mental health type of calls, that Officer Scanlon and the clinician could respond without an actual call for service to the patrol side. So that would be huge to help us on the patrol side, for the officers to reduce their calls for service. And it's just, it's a win-win where you can help the community with the mental health aspect of it, as well as in the long term, it will help the police department be more efficient to concentrate on some other things as well.
Right, so I know that you've been through school, you've had a lot of schooling. What makes you qualified? I personally know how, but why don't you tell everyone what makes you qualified to be on this task force to help people?
So I am about a little more than halfway through my career as a police officer, and just a little about 2.5 years ago, I made the choice to go back to school. I went through Cambridge College's mental health counseling program. So part of that program involved an internship component as well. So I've had, some of the education on the background. I've had some direct experience in the counseling world.
But it's intensive experience.
Yeah,
it's
yeah.
Intensive training.
Definitely intensive training. The internship program is pretty intense. There are a lot of hours that you need to put in. And then while you're doing that, you're engaging the skills that you were learning in your studies in school. So that in itself makes me a good fit for this.
Exactly.
Yeah.
And I wanted people to know that you're not coming in helping these people blindly. You know what you're doing. You know how to help them. And what type of services are available for people?
So I think the exciting thing about this program is it's going to provide a range of services that the community will have access to free of charge, thanks to the funding through the Department of Justice that the police department has received, the city has received. And so we'll be providing immediate access, as Officer Scanlon said, on scene with a master's level mental health clinician, as well as Officer Scanlon, who is uniquely qualified, one of the few in the state to sort of have that dual capacity.
And very personable. You can, I know that you won't talk to someone technically, you'll get like personal. You'll talk to them on a personal level, like friendly. That's what I'm trying to say.
It's an important part of
course.
interacting with people who are experiencing either a mental health crisis or just having a bad day.
Yeah.
Is creating that rapport with the person, trying to establish some sort of relationship so that they feel safe.
Right. And I'm sorry, I didn't mean to interrupt you.
No,
Yes, I did.
it's absolutely it's absolutely great, because absolutely when we select officers and we select clinicians for this kind of a program, you're always looking for folks who are going to be able to have that real-time connection with people, and that they feel that you actually care and that you actually have their best interest at heart. And so even when we just completed the process of going through and having to find just the right person for the clinical role, and we were very excited for them as they join our team. So they'll be able to provide those services on scene. The exciting part about that is that the concept within a co-response program is that if we can, we will provide the services right then and there in the house with the abilities that we have. The goal is not to have you go to the hospital. We don't want you on an ambulance on your way to Holy Family or Lawrence General. We would prefer that you are right there at your house getting the care you need. And we also don't want to get you involved in the criminal justice system. So the main goals here are to keep folks to get the care that they need. And so they'll be able to provide those real-time resources right then and there on scene. And then on top of that, like I said, we'll have access to outpatient services at low to no cost to folks. We will be able to help work with them on any sort of social issues they may be having around lack of insurance, lack of access to food, things of that nature. And we'll work with the community at large to provide more prevention, education, be able to make those connections for people to services.
So you're in touch with a lot of outlets to help these people. You said food and things like that, which is great. Do you want to add anything to that?
No, I think that they answered that pretty well. I really am happy to be part of this program just based on my background, and I know that empathy is very important, and I know that knowing and working with these two already that they're very empathetic people, and that's what you need to be in this type of environment, and I think that's a good thing for the city.
And that's a word I was looking for to describe Gina, because I know how she is empathetic. What is the cost of accessing the services?
So that, I think, is the great part. As far as our co-responders go, as far as the community response team will go in the fall, all of that is free and paid for. That is paid through federal grants from the Department of Justice, police department, the city, and Frontline were able to secure just under $1 million of funding for the next 3 years, which will cover the cost of programming. There is a component where the police department and Frontline put in some funding to sort of prop up the project and to show that we mean what we say and that we're going to follow through. And for the outpatient piece of it, the majority of it will be at no cost to folks. We will turn nobody away, so if they don't have access to insurance, we're going to see them. That's not a problem. If they do have insurance, we're happy to work with their insurance to bill their insurance. But the point is to get immediate access to care regardless of ability to pay.
Can you explain to me what Frontline, I can't read the bottom of your shirt.
Sure.
Explain what Frontline is and how you're part of the group.
Yeah, so Frontline Services focuses on working with communities to provide connections to care. So we work with cities, much like Methuen, to help develop community integrated programming, which with Methuen's amazing mental health task force, that is sort of what we look for, right? Is this sort of cross-department, cross-agency connections with a city mayor, city council that is very involved in mental health, which is great. And so we work with communities to develop these kinds of programs to bring access to mental health, emergency mental health services directly to the community members who need it the most, and to be able to provide access to those services. We also do work in education and training for communities as well as companies and things like that. Our background has been doing co-response work since, I would say, like 2017. We've been doing this kind of work. We've had some success with it. And sort of building out these innovative, sort of forward-thinking programs.
Right. Now, did you approach the city or did the city approach you?
The city approached me, and so I happened to have a
to join the
colleague
task
in place.
force.
Yeah, I had a colleague who was at the time working on a project with Chief McNamara. So Chief reached out and said that he would like to have a meeting and have an opportunity to discuss sort of his visions for this. And so we had the opportunity to get together, and timing was perfect. He reached out. We were looking for a project. It was coming up on time for the federal grant application window to open up, and so we were able to work with myself, him, and the mayor to get the process underway, and the rest is been a success so far.
That's good. So you must have been excited to, like, have him on your team and be a part of your team. And wait, next question. When will the services be available?
So co-response it has been live since April, late April, and then the community response team will go live probably about October, mid to late October. We have to get approval from the federal government. They have to stamp our process and say, yes, this is what we were hoping for. And as soon as they give us the green light, then we can go ahead and hire that staff. So that'll be probably in the fall. And outpatient, as soon as we have referrals, we'll open the doors.
So I'm going to give you a scenario, and either one of you can answer. You get a phone call, dispatch gets a phone call. They always get the first phone calls. Dispatch gets a phone call. They have someone who's distraught on the phone, or they have a family member on the phone, and my husband is talking, I'm going to use just generic word, my husband's talking crazy, I don't know what he's going to do. You obviously send a cruiser there to whatever, and how do you handle it from there? The dispatcher, I'm sure, would ask more questions.
Right, so the dispatcher would dispatch somebody from patrol or a couple of members of patrol over to the call, and knowing that it's already, involving some sort of mental health component,
right,
they'll probably call me as well, and myself and the clinician will start to head over as well. When the scene is safe and there's no other cause for police presence, like there's going to be no arrest made or any other crime has occurred, then the patrol officers will be relieved from the scene, and myself and the clinician will kind of take over and really, assess the client there, right in their home, see what kind of services they may need, how we can help them, talk with the family members that are there, kind of get a little bit of a story of what's been going on, and see, depending on what is said and what we observe, we would determine what would be the best next step.
So I'm going to give you some what ifs. He threatened his wife to kill her.
So again, all of that depends, right? So it's going to depend on, did he say words? Did he have a knife in his hand? So all of that will depend case by case on how things will go.
Yeah, so you don't know. Have you ever, well, I don't want to know, you haven't been called to a scene like that?
There have been plenty in our community.
Well, I know. I mean, you've had to go to already. That's sad. I mean, I feel bad for these. I really do. When I say that's sad, I mean I feel sad for them that they're in this distressed situation. So, I gotta ask you some questions. You're just sitting there.
So I've done a show with you on this series.
Yeah, you did. We did Behind the Blue Lines, and I gotta tell you, I was nervous yesterday, and I couldn't figure out why I was nervous because I didn't have my co-host from the other show on, and I'm like, oh, okay, there's no one else to talk to. But yeah, we did your show last month, which was wonderful. It was how police officers handle traumatic situations. And
take care of ourselves,
how you take care of yourselves, and of course Officer Nicolosi made me cry. Not hard to do. So yeah, that was a pretty good show. So how are you after you handle these situations? Because you're helping someone, which I'm sure they're glad the help is there, or the family member is glad that you're there. How do you handle that after you're done? How do you take care of yourself after?
There's
Because I'm sure it hit you.
Of course, yeah. There's a big piece to, the mental health counseling world, and even us, everyday people in everyday life, big talk about self-care, right?
Yeah.
So for me, it may look like just taking some time for myself to kind of process what happened. It may look like having a conversation with Matt to, kind of go through the steps of this is what happened, this is, what I did, and kind of validating that for myself. It may be going for a walk, it's going to look different for every person.
Right.
For me, I do like to take some time for myself, but I also like to run things by, somebody who's my boss or a coworker, things like that. So, self-care is big. It's big for everyone.
Yeah.
And recognizing when you're struggling or don't know how to handle something is a big deal. And being able to say that you need help or you just want to talk about it is also a big deal. I think a great aspect of this program is going to be that, we're not only co-responding and helping people get services, there's going to be an education piece. You may see us at National Night Out. You may see us at, our annual open house, providing information, getting information out there, reducing the stigma, right? Mental health is health. We've heard
Absolutely.
that. Combining that with self-care in itself is important.
And this city's had its share of crises. Did I say that right? Crisis. Had its share of crisis, and the last couple of years has been, just heart sinking for a lot of people. Our friends have lost their children in accidents, suicides. I don't like to say that word, but it happens. It's there. It's real, and people need help after. And it's not the person who left; it's the person they left behind who needs that care. And some of these people want to help each other. So, like my friend lost her son last year, and she wants to help people. That's how she wants to heal herself, by helping other people. And she's doing it one step at a time.
That's the beautiful part
Yeah.
of programming like
It
this.
just kind of hit me for a minute, so I had to stop for a minute. So.
It's a beautiful part of programming like this is, when we talk about the community response team, for example, that is going to employ a peer support specialist. And that's a term that is getting more popular, I think, now. But what we're talking about there is someone who has lived experience. This is somebody who either themselves lives with mental health, or has had a family member or has a family member who struggles with mental health.
Right.
And so they can relate on a level and make connections with community members unlike anything as a clinician, as an officer,
Right.
That we can make. And then on top of that, we are excited to work with the library, for example, the health department, right, to bring about support groups. We've talked about doing support groups. We've talked about running, peer groups to get folks together to be able to do peer support. But to have that group setting, right, to break that isolation, to help break the stigma, to allow the community to come together, talk, and to heal is a huge opportunity of this kind of work, and one that we're very excited to be able to bring forward.
Well, I'm happy for it. Why do you think people are afraid to come together in a group? Like I've heard, I've said to people, why don't you go to this group or that group? And I don't want to go and discuss my problems and let everyone know my private problems. And me, I don't care. I'll tell anyone anything. You guys know that. But some people, are afraid to say, well, I go to a therapist. Like they whisper things. Like I'm the only one in the room. Why are you whispering therapist to me? No one's around to hear it. If you don't want anyone to know you're going, don't tell them. Don't go to a group. If you think that you can heal yourself by just seeing a therapist and not talking to other people, fine for you. But where is that stigma that I don't want to go into a group setting and discuss my problems with other people who have the same problems? Where do you think that comes from? Why?
I think some of it is the sense that we believe that we should be able to handle it on our own.
Yeah.
This sense that we have screwed up or that we aren't good enough, we're not worthy of that support, plays a big role in
And that's
it
so
for
not
us.
true with people.
It is, and it's so, and then the other thing is we often think we're the only one who has this particular concern or this particular issue or a family member, right, that's struggling. And I can't tell you how many times I've worked with folks who have come to a group and they have an opportunity to meet other people who are thinking the same way they do, have the same thoughts, same concerns.
And are afraid to say it, right?
And they're afraid to say it, but then after a few weeks, they're like, oh my gosh, this is what I needed. And so sometimes it just takes time.
Yeah, she and I have had some deep thoughts.
I think too, when you're thinking about like where does the stigma come from?
Yeah.
When you think generationally, and even culturally, right?
Yeah. Oh, yeah.
There, you know, some cultures you don't speak about matters that are in the home outside of the home.
Right.
Or, you know, you don't share what you're feeling, right? And even generationally, you know, I kind of grew up in a generation where you just kept going.
Yes.
Oh, so-and-so passed away, that's really sad, and you go through
And the next day,
the services, and then
Yeah.
you go back to work, right?
Right.
Keep your mind busy, you'll be okay.
Yeah.
And so I think
But it's
a lot
not,
of...
it's always still in the back of your mind.
course,
You know,
yeah.
you need to heal that,
Yeah.
you know?
So I think that's a lot, too, where, you know, that stigma comes from.
Yeah. I'm going to get back to these, to the PATH program. So can I have the slide where you can contact PATH, please? Yes. So you want to, this is where you contact PATH, right? How people can contact PATH?
Yeah, so any community member can reach out at any time. It doesn't require a crisis, obviously. If you're in the midst of a crisis,
Right.
You want to call 911. But if you are just have some concerns or you're looking for some support,
Right.
you're out in the community, you can call this number, leave a message, talk to somebody during business hours. Our email also there, and we're also
you're
on social media as well. Yep.
That would be the next slide. I forgot we had slides and we just kept talking. I'm sorry. So you can find it, you on social media. And the next slide. So Jean, you want to talk about this?
Yeah, so kind of like we mentioned at the beginning, this program really is a collaboration with the city and all the various departments, many that you will have had on the show here.
Right.
So it's really that collaboration that's going to help, you know, really get that client the services that they need. You know, if there's a program or a service that the health department offers, and we were the first ones in contact with the client, we'll be able to reach out to the health department for them or have them call and see what services would be helpful for them. And again, you know, we talked about the services that we'll be able to provide as far as prevention goes, education, the co-response program, the community response team. There's a lot of different pieces that fall under what PATH stands for.
Can you go to the next slide, please? And she just explained this, the partnership between the two. And then the last slide, the initiative between all the departments. What can I or anyone else expect from the crisis intervention team when you come to my house? You touched on it a bit, but what else can
I think that you can
What if,
expect.
I'll give you another scenario like I
Yeah.
gave you. I'm very depressed, and I'm at my wit's end. And what can I do? But before we answer that, we're going to take a 5-minute break, and then we'll jump back on that.
Great.
Okay? We'll be back in 5 minutes or less.
When stress shows up, it can be hard to see. Maybe you can't sleep, or you feel sad and you don't know why. Or maybe it's worse, because stress can knock you down. It can hurt your health and your relationships. If you've lost a job, worry about your next meal, or have trouble making it through the day, we can help. Text STRESS to 211-211 to find a solution.
The innocence of youth. Is there anything any better? But soon they'll be in high school and facing all the same challenges you faced. How to make friends, how to fit in, how to be cool. We want our children to have everything they'll need to live fulfilling and productive lives. Make sure the kids in your family are among the more than 230,000 participants here in Massachusetts who take part in high school sports.
And welcome back from our break. Welcome to From Stigma to Strength. And let's pick up where we left off. So what can I expect if a crisis team comes to my house?
So I think
example.
So I think I'll give an example of a case. Obviously, no real names, but
No. You can use mine, I don't care.
so we had an opportunity to respond to a person. I actually had the opportunity to respond to this case myself. Person, much to your example before the break, really suffering with deep depression.
Yeah.
Also struggling with alcohol use in order to help support the depression. And gotten to a point where she was calling the police or having the police called on her on several occasions for verbal assaults, verbal arguments that would get to a point where the neighbors would be calling. DCF was called in due to a child being present and like child not being cared for properly. And so myself and the officer responded to the home, walked in. At first, she was very reluctant to meet with us. We explained while we were there. I think it's important to mention the unit shows up in a unmarked vehicle, meaning there's no police insignias, no nothing on the outside of the car, right? So your neighbors don't know necessarily that you have this team showing up at your house. There's nothing that says mental health on the side of the car or anything like that. And the officer is dressed in plain clothes, jeans, a polo, maybe something along those lines. Clinician, same thing, wearing clothes very similar to what I'm wearing. And have the opportunity to just, have a conversation. So we spoke with the woman, and I just sort of simply said, I'm here to support you, whatever that looks like. And so if you just want to have a little conversation, we can have a little conversation. If you want to have a larger conversation and you're looking to gain access to some supports, we're happy to have that conversation as well. The first time I met with her, we sat around the kitchen table over I'm pretty sure it was a cup of tea, because she was a tea drinker. Sat around the coffee table, myself, the officer, and her. She was in the process of sobering up, and we just had a conversation about how she was feeling, how she got to where she was today, and what support looked like for her. And in that moment, she wasn't ready to say yes to everything we were offering. We were offering a place at a detox. If she wanted it, we were happy to set her up with an intensive outpatient program if she wanted it. We were happy to come back and meet with her however many times she wanted. And at first, it was a no. And we checked in with her periodically. And about a couple weeks later, after a couple more police calls to the house, she said yes. And we said, okay, we'll be right there. She said, is the offer still stand? Absolutely, we'll be right there. Went out, sent a car. We were able to pick her up, helped her pack her bags, get everything she needed for treatment, got her placement, got her off to treatment, worked with her after she came out of treatment. While she was in treatment, we helped support them, and supported her when she came out of treatment. We were able to work with her and help report to DCF. We did breathalyzers for her as well, to be able to prove to DCF that she was sober.
So they were mandated.
Mandated,
Yeah.
yep. And through working with her and helping support her, she was able to regain custody of the child. So when we say we're in it for the long haul,
I guess so.
we're in it. We're happy to be
Wow.
there for as long as a person needs, whatever that support's going to look like. And I think what's exciting about, again, the work here with Methuen is that the whole city is in on it together. They're working hand in hand. I've never seen a project that I've worked on where so many aspects of the community got their hand up and they're ready to go.
Yeah.
And that is so exciting.
So so she's doing great, I'm assuming.
Yes.
It's wonderful.
Yes.
So now do you still keep in contact with her? I'm sure not as much as before,
Yeah.
but
She
to
ended up
keep
getting
updated?
she ended up getting a full-time job. We celebrated her sobriety when she hit 1 year sober.
No kidding.
It was a very exciting period of time. She ended up bringing several people into the fold to get additional services, friends, family members that she was aware of that needed help who also lived local. And so, these are the sorts
That's
of
the
stories that
domino
we're
effect
looking
that you
for.
like to hear.
Yeah.
It's like not a one-stop shop because you were with her from A to Z, and
Yes.
wow, what an incredible story. What an incredible, I cut you off, I'm sorry, my bad.
No, thank you.
Yeah.
It is. It's just an incredible opportunity to really support folks, meet them where they're at, and provide them the level of support that they're willing to take
Yeah.
at that point.
So you helped her with everything. Were you
Yep.
part of this group as well? Part of this
No,
story?
I wasn't part of this one.
Yeah,
No.
that's like a really feel-good story, but you don't shy down from when you had your problems.
No, I find that you get to a point where you're recovered enough in your healing process
Yeah.
where you are able to share your story to try to help other people
Yeah,
out.
and
That's where I'm at now.
Yeah, you inspire a lot of people, and
Well, I appreciate that.
yeah, I mean, I've talked with you a few times, and you're like I've never been one to like indulge in, alcohol or drugs, and it just my brain doesn't work that
No,
way. If I do, I just like fall flat, and I'm like, I'm good.
And that's why I appreciate being able to be part of this, because it
Yeah.
does mean a lot to me based on what I went through personally. And I'm a human being just like everybody else. And
Yeah.
we all can have problems.
Well,
We're
just
human
because you
beings.
wear a uniform doesn't mean there's not a person underneath. You have families, you have children, you have
Right.
lives, and
But that goes
know.
back to the stigma thing we talked about before.
Yeah.
Years ago, our mental health and personal care was put on the back burner because
course it
we
was,
were
yeah.
going to go do our jobs and get them done.
Yeah.
We went from call to call to call, and we dealt with critical incidents a little differently years ago than we do now. So,
Yeah.
And this, like I talked about, this program will actually help in the long run the officers, I believe, mental health and well-being as well, because it's going to eventually reduce the cost for services because of the program. It does work, as Matt just
Yeah.
spoke about. I can speak to the program, and I was alone a lot during my time,
Yeah.
felt very alone, dark, deep times, and through other people and helping out outside resources, and that's how I got through it. So
Yeah.
the program works, and it's just
Yeah.
being able to let people know that it's there, and if they're able to convince themselves that they're worth the treatment, they're worth their best days, which can be in front of you. Anybody
Yeah.
can have their best days in front of them.
Yeah.
It's just taking the services if you need it. And I think with the program that they're putting forth here, that you're going to see a huge change in the community. You're going to actually, you may not fix 100% of the problems and not fix it right away, but it's heading in the right direction. And I see that on the law enforcement side.
Right.
Based
right.
on our first show. Years ago, we didn't have very many, they may have been there, but we didn't have access to them.
Right.
I know I didn't. So it's good to see, not only for the law enforcement and the first responder community, but also for the community as well.
Right.
And that's what we're seeing. It's all coming together.
Yeah, and I hear this a lot. People talk about the politics and the politics in this town, and it's the politics stink, blah blah blah, blah 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 blah. But when something happens, something tragic happens in this town, I've never seen so many people come together as like one person, as one. Everyone helps each other out no matter what it is. No matter how many times somebody talks bad about the mayor, don't worry about it. It could be like, the police are this, that, and the other thing. The fire department does nothing, the DPW. No matter what it is, those people will come out and help each other.
I think during a crisis, you're going to have everybody do their job.
Yeah, exactly.
So they're going to do their
But
job.
it's not just you or the fire department or whoever.
So everybody in
it's
this- yep.
everybody.
Yep.
Everybody just comes out and just comes together.
And it
So-
goes back to teamwork. The more people you have involved in this, like Matt said, it's better. And,
Yeah.
The more resources you have, the more people involved, the more ideas that come out. Sometimes we're so task oriented that we don't think about better ways to do things.
Yeah.
So it's good.
I'm happy. So my last question, if I call 911, I need help. I need clinical. What can I expect? How can I ask for clinical services when I call 911 as an emergency call?
Yeah, so when you call into 911, I think that there's this little known thing that you can do, and you can ask a couple of things. You can ask if a clinician is on staff, or a clinician is on call, and if so, they're happy to send a clinician out. The other thing you can ask for is for a crisis intervention team
Yes,
trained
okay.
officer, a CIT trained officer.
Which Gina is.
Which Gina
Yeah.
absolutely is. And,
Are you the only one at the police department who is trained in crisis intervention?
No.
we have about, I think right now, around 80% of
Oh,
the
good.
officers are trained in CIT, and nearly 100% of them are trained in mental health first aid for law enforcement.
Right, yeah.
And so that when you have a CIT officer respond to a scene, this is an officer who has had extensive training in mental health, has been taught about what the local resources are that are available, how to de-escalate a situation, how to provide the right kind of services in that situation. And so, you know, that can go a long way to help support somebody who is, you know, not sure sort of what the next steps are. So you can ask for a CIT officer, or you can ask for a clinician if a clinician is available.
And what will they do?
So if
Will they get on the phone or ask where they're
they'll head right over to you. They'll
Okay,
head right over to
yeah.
you. Yeah. So if you're calling into 911 and it is an emergency, they're going to send the unit right over. So you know, for example, if the CIT unit is on shift, Gina and her clinician counterpart would hop in their car and head over. And be able to provide those services right then and there. If for some reason it's after hours, the officers are trained to reach out. We're providing after hours clinical support to them in the overnight and on weekends. So at any point, if they're on scene and they feel that the person would benefit from access to a clinician, they can call up and talk to a clinician on the other side of the phone. So there's always some access to a clinician at some point.
at all times?
Yeah, at all times.
So if you get more than one call, you're readily available to send, because you're all trained, most of you are trained, readily available to send someone to each call. Correct?
I would say for the most part, yes.
Yeah.
But to have the interaction with the clinician,
Yeah.
if there's more than one mental health call going on at the same time, you know, we would have to kind of assess the situation there and see where the clinician may be needed more in that incident.
All right.
Prioritize what location to go to first.
Yeah.
Yeah. So on average, and I don't know if this is going to be a tough question to answer, we're in April right now. How many calls do you think you get, say in this first 4 months, that you've received for services? Or in a year, like just like throw, you know.
Yeah, so
made you
we kind
think?
of mentioned at the beginning of this show that, you know, when we're looking at the numbers for calls for service, we're looking at approximately 25% of the calls that are coming into the police station are mental health related or have a mental
Really?
health component. Yeah, and so that's a significant number. It's not to say that the call is solely mental health, but maybe it was, you know, there was a crime involved, but there's also some mental health component to the call.
Yeah.
To, you know, somebody involved in that incident. So 25% I would say is pretty high.
Do you think it is? It is high. I think it is. But do you think it's more men, women, or young folks, young people, or is it a mixture of? I mean, who's in more crisis?
It's tough to say. The data doesn't show a favoring to any one particular demographic
Right.
as yet. I would say, traditionally speaking, it's usually, I would say, men 25 to 45. We see that I've seen just over various projects over the years, and young people.
Right.
I would say, you know, from age 5, 6, all the way up to 16, 17.
Wait, 5, 6?
Yeah, I've done as young as 2 or 3 for interventions, especially, you know, for behavioral issues,
Yeah.
you know, things like that. We see a lot with young folks, but I would say, by and large, it is typically, I would say, more male, sort of that mid-range age, that are having encounters. However, I would say their female counterparts are more inclined to say yes to services,
Yeah.
to be able to accept
Father,
services.
partner, or
No, for themselves.
themselves?
Yeah, for themselves.
So it's a woman would ask for help before. Well, men, there's a pride thing.
Right.
I get it. I get it. You guys think you're cool. No, I'm kidding. No, well, actually, I'm not kidding. But it may be a pride thing. Maybe that's how they grew up. Are they calls for PTSD, stress, depression?
I would say by and large, here in Methuen, when we looked at the data in the early days when we were trying to decide where we were heading with the design of the program, what we found is out of the 25% of the calls for service that were coming in that were mental health related, over 55% of them were having to do with suicide or suicidal ideation,
Right.
Meaning folks are having suicidal thoughts or are attempting suicide. And so that told us right away we need to place our focus on prevention, first
Yeah.
of all, and that needs to be the predominant sort of focus when we go in is how do we help someone who is perhaps at a point with their depression or their struggle that they're contemplating suicide. And so that I would say is right now sort of the major focus.
And through this mental health awareness task force, have you helped these people? Have they been helped? Have they sought help?
I think we're seeing increased visibility in the
Yeah.
community. I think the library is doing a phenomenal job at trying to promote education in the area of suicide prevention,
Yeah,
both
they're
with
going to be
youth
on next
and
week, so
adults.
I'm looking forward to that as well.
Yeah, and we're excited to be hearing directly from the community and starting to engage with the community. We won't know for a little while longer, probably I would say the fall, what kind of impact we're having, but we're excited to see where it goes.
Yeah, I'm glad. I'm happy for this whole team. I want to touch briefly, Lieutenant, on your community policing deals with a lot of young people.
Yes.
Obviously, children, basketball. Have any of them ever come up to you and said, look, I'm struggling, or have they ever tried to reach out to you?
We have had kids do that.
Yeah.
Excuse me, in the basketball program. We also, we're putting together an ice cream truck where we borrowed one in the past where it gets us, get a little water, but they get us a little closer to the kids.
Yeah.
So
I'm looking
more and
forward
more
to it.
we're seeing that the officers are doing more community policing
Yeah.
related stuff. So, I'm sorry, I'm just having a little bit of air.
Get into the sip. I'll ask Gina a question.
No, I'm fine. I appreciate that.
I'm happy.
Yeah,
I'm not shy.
So we're,
Yeah.
but not as far as like, we don't have a lot of kids like approaching officers saying that they have any problems per
Yeah.
se. But the officers are very good about interacting with,
Yeah,
with
they are.
the younger
Yeah.
generation. We have a very well-rounded, I think, police department who
Yeah.
gets out there and gets into the community.
Well, they're all young at heart anyways.
Yes,
the guys on your
we are a
team.
very younger department, so that's
Yeah.
great to see. So.
Yeah. I just lost my train of thought. I was thinking, so if you go to a home that there's a crisis at, there's little kids, do you guys have teddy bears in the trunks to give them?
So we do have like fidget items that we hold on to. We've got some other things. Yeah, I've done in the past. We've done like stuffed puppy dogs and stuffed teddy bears, things like that,
Yeah.
to have on hand, in order to provide like comfort.
Yeah.
In that
Yeah.
way. Yeah.
So this is probably off subject, but if somebody, I've had friends ask me, because I know that they know I interact with you all, if somebody had a big bag of stuffed animals and they wanted to donate them to you, obviously they'd have to be clean, washed, and whatever. Can they still do that, donate them to you?
I think we still take
Yeah.
them. We'll take them right in dispatch. They can walk them right in.
Yeah,
and,
as long as they're
you know,
clean and whatever. And
yeah, from a smoke-free home and,
Yeah.
and things like that.
Yeah,
Yes.
that wouldn't be my home. Quit that smoking. How much time do we have left? I just want to ask them. Do you want to add anything else? All right, 10 minutes left. You first.
I think that overall, I think the important thing to know is that these folks are here to help the community,
Right.
and take advantage of whatever you feel comfortable taking advantage of as far as these programs go. This is something that is extremely exciting for the community. I know I'm extremely excited to see what the city is doing, and to be a part of it. And I think that the more that we get the word out, I'm a huge believer in the more we get the word out, the more traction the program can get, and the more successful and the more healing it can bring to the community.
Yeah.
And I mean, just kind of following up with what Matt said, I really look forward to working with the city as a whole, the various departments, and to really help, provide what it is that person needs. Are they depressed because they're struggling because they can't make their mortgage? Well, let's see if we can work with a department and see if there's assistance that we can, connect them with there to help them with their bills, to help alleviate that stressor and maybe make things a little bit easier for them while we're working on that depression piece with the clinician, right?
Yeah.
So I'm looking forward to working with everybody. I'm looking forward to learning from Matt and working with the lieutenant on the police side of things. This is a brand new program for the city, right?
Yeah.
So we're literally...
It's exciting.
Yeah, I mean, it's exciting, it's new. We're working through many things and growing the program, so lots of good things to come.
Good, I'm glad to hear it. And Lieutenant?
First of all, I'd like to thank the city of Methuen for actually collaborating the task force, and also thank MCTV still?
Methuen Community Studios.
Studios, okay.
Yeah.
I'd like to thank the studios for having this series, because I think it's very important, and we brought the word up of stigma before, and this is the way we're going to help reduce the stigma by talking about it openly, getting it out there that, hey, we are all human beings, and we all have some level of anxiety. We all have some level of depression. We all have some level of mental health problems, because we're all human beings at some point, and we're all going to go through stuff.
Yeah.
If you think your life's going to be solved one day and all your problems are going to be solved, it's not going to happen. You know, life's going to always throw some curveballs at you. It's just that these are the services that are there to help people to get back on track.
And doing something drastic will not solve any problems at all.
No.
So
we all know that. So I just want to thank you guys and the city as well, because this is going to help reduce the stigma.
Yeah, and thank you for joining us. And this came about. We knew about the mental health task force, and on our last show with the police show, we had been trying to get that going for a while, but you were tied up, and Joe was tied up, Lieutenant Ayala was tied up, and when it finally came together, we were like thrilled.
Finally, yes.
So Carol Ann and I had known about this task force, and we're like, well, let's get them on. So it was great that everybody was on board with it. So we're thrilled that we could finally do this, and so that's going to be it. Thank you very much for joining us. We appreciate it, and we will see you next time on From Stigma to Strength. And remember, it's okay to not be okay. And have a good day, everyone. Thank you.